I'm Dr. Raymond Lamb. I'm pleased to be here with Ms. Sophia Van Noorden describing our BC Depression Hub. Our hub is actually a joint hub with CDRIN and the Canadian Network for Mood and Anxiety Treatment and the UBC Department of Psychiatry. And we call our hub the BC Depression Reach for Research, Education, Awareness, and Care Hub. We think that's a very appropriate name because we're trying to reach relevant researchers, clinicians, people with lived experience, and importantly, funders in order to reach our goal of improving outcomes for people with depression. And so we're very pleased to do that with, I think, a very good team of people. I'm going to just lead you briefly through our leadership, some of the priorities that we've identified, some of the progress in the past 6 months since we've created the hub. And Ms. Sophia Van Noorden will talk about some of the activities of the lived experience team from our hub. So our hub is led by an executive steering committee comprised of myself and Sophia, as well as Dr. Lakshmi Yatham, again, a very well-known researcher in Canada and internationally, and other executive members, including Dr. Nigel Fisher from our Fraser Health Authority, the largest health authority in BC, as well as Dr. George Hadjipavlo, Aaron Mihalik, and the head of our department, Dr. Bill Honer. As well, we also have a project coordinator, Cindy Wu, who really runs the logistics of our hub. We actually have representatives on the hub from most of the depression-related agencies throughout BC, including Mood Disorders Association of BC, Canadian Mental Health Association, the BC division, as well as representatives from all the health authorities in BC, because a great opportunity is being able to link some of the important people interested in depression research and treatment throughout the province of BC. We have one medical school, we're fortunate that way, that extends throughout in a distributed program, and so it makes it a little bit easier for us to reach out to some of the key people in the province. Some of the priorities that we've looked at, we firmly believe that information is the key to change, and so a great priority is establishing some of those information linkages and networking through active communication. We're using technology in terms of looking at active webinars to reach all the different regions in BC, as well as holding an annual conference for knowledge exchange amongst members. You'll hear more from Sophia about some of the research training workshops for people with lived experience. But we're also interested in health services and looking at things like a clinical outcome monitoring system for important treatments like electroconvulsive therapy, with a real focus that we have on measurement-based care and improving and promoting measurement-based care for depression. We've also looked at strategies and projects to identify young people who are at risk of mood disorders and looking at strategies to prevent the onset of mood episodes in those people at risk. And again, we've heard from our lived experience team how important it is to look at care maps for depression treatment. Unfortunately, it's still not very standardized in terms of what happens to people when they enter treatment for depression and anxiety. We're trying to demystify that with some active care maps. So some of the activities that we've been doing, as I mentioned, over the past 6 months is really focusing on network building and communications. We're establishing a census of people who are interested in terms of research, clinical care, people with lived experience, and looking at some very practical, pragmatic, clinically relevant projects, including things like using online technologies, our Mood Effects app, which I'll actually talk a little bit more about in this afternoon's panel on virtual mental health, as well as a pilot project that we've started on this clinical outcome monitoring system for electroconvulsive therapy. We're also launching a bipolar wellness center online in the next couple of months. This is a very interesting project by CREST BD, our research network on bipolar disorder and psychosocial treatments, led by Dr. Aaron Mihalik. Now I'm going to pass it over to Sophia to talk a little bit about some of the experiences for our lived experience team.
Thanks, Ray. So how do I get to be a BC Hub leader? Well, my most recent position was as Executive Director of the Mood Disorders Association of BC, and prior to that I had been on the board of MDA BC. Now, as a result of my work and experience with MDA BC, I have many contacts with the various organizations and BC Provincial Health Services that provide services to those with mood disorders. And also, during the time that I was with MDA BC, I had the opportunity to participate in a number of national projects with the Mood Disorder Society of Canada. Now, as Ray talked about, CREST BD, an organization, international organization based at UBC that does psychosocial research. Now, I'm co-chair there of the Community Action Group, and I've actually seen what people with lived experience, how they participate and make research more valid, also speed it up, and are able to get the results of that research to, as they call it in academia, knowledge translate it, and then knowledge transfer it to the people and organizations, well, the organizations and the people that really need to get it. Now, when it comes to knowledge translation, it's my undergraduate degree in biological sciences and my master's degree in business that will help me repackage this information. And this is actually my second career. You're wondering what I did with the first one. I worked primarily in the hospitality and catering business, food production, and was the menu design manager for Canadian Airlines. Now, when Air Canada merged with CP, not surprisingly, I was downsized. And in that time, I had a lot of time to think about what I was going to do, and of course, I fell into a depression after this time, one of numerous ones during my life. I had my 50th birthday and decided I was really tired of working so hard to make sure that nobody knew about my bipolar II disorder, because that would definitely have been the end of my executive career. And I've also, I think I'm an example of that despite a lot of support and no matter how good the education, the opportunities I've had, and the healthcare support, there still needs to be more done to allow people with mood disorders to lead a productive life and be the best that they can be. Now, I noticed Ray said that I'm going to talk about lived experience and workshops and my experience with CREST. I think the music's going to go and the coffee will be served if I get into that. So find me if you want more information on that. And also one of my colleagues from CREST BD is here who is actually involved on a very interesting project. Andrea Paquette, can she stand up? She's very knowledgeable on this kind of thing as well. Anyways, I'm very excited to be working with Ray. I'm honored that he has asked me to lead the lived experience team. And thanks very much. I have to keep it to 1 minute.